Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Welcome back to Between the Sheets. I have a fun guest on here for us today. We have Dr. Jennifer McBlaine. She is a PhD. She is a clinical sexologist, and she is also founder and CEO of the Kiss and Tell magazine. Her mission is to demystify sexual, mental, and physical health and help us all live a better life. So welcome, Dr. McBlaine.
Thank you. You can call me Dr. Jenny. That's my
That's
thing.
your go-to?
Yeah.
All right, perfect. How did you get...
I usually do Dr. McBlaine when I'm in a session.
Yeah, I get that. Okay, so how did you get into being a sexologist, and kind of what are the clients you work with? What are some of the issues that you're seeing people for?
So the reason that I got into sexology is because I knew it was a subject that I would never be sitting there humming, and I knew that every time I was working with a client, I would be interested in what they're saying.
Yeah.
So, because sometimes prior to finding that degree, when I just had my master's,
Mm-hmm.
it's not that I was bored with what people were saying. It's just I could tell I wasn't always present
Yeah.
in the session, which obviously, as a therapist, you're trained to be present.
Right.
But I could tell based on the topic, I'd be like, I can tell I'm not fully in the moment.
Mm-hmm.
That was for the reason when I learned about the sexology degree, I said, I'll always be in the moment for that.
Yeah, that's wonderful. That's great. What parts of sexology do you see a lot of your patients coming in for? What are their problems?
Mostly it's communication.
Mm,
No one teaches you how to talk about not just sex, but just in general how to have a healthy relationship.
yeah.
Communication is probably the biggest, in my opinion, biggest issue for couples. It's not just talking; it's listening.
Mm,
So when the partner replies, do you really hear what they're saying, or are you too busy thinking about what you're saying next?
mm-hmm.
So, to me, like I said, it's communication.
Yeah.
And then the difference is, so one partner may want one thing, one partner may want something else. They don't know how to compromise.
Mm-hmm. Yeah. Do you have patients that come in with like different libidos between themselves and their partners,
Oh
or
yeah,
yeah.
and
And how
it's not. A lot of people assume men are more ready to go,
Mhm.
so to speak, and that's not true. Men have
Yeah.
issues with their libido just as much as women do.
Yeah.
The difference is we don't talk about that.
Right.
We have to give men always the kudo. Ready to go, all you gotta do is be naked.
Right. Right.
So, which is unfair to them, because to me, by us continuing that misinformation, it's hard for men to talk,
Yeah.
because they realize they're not matching the stereotype that they're
Mhm.
being fed. So, yeah.
Yeah, that's interesting. And one of the things that I'm working on with my patients as a urologist is not only asking about their quality of their erections, but asking about their libido and the quality of their orgasms as well. Because if you have an erection, but you're not achieving orgasm or you're not desiring sex, then who cares about the erection? And vice versa. If you're not able to achieve an orgasm because you can't get the erection, then that's something that's interesting to talk to men about. So I've been trying to be more sensitive to including the whole gamut of the sexual wellness part of it instead of just caring about their erections.
Right. Good.
Yeah.
Good for you. I'm glad that you're aware of that, because I have met, physicians who
Mhm.
aren't, and, I'll leave it there.
Yeah.
I don't want
Well, a big part of why I've kind of tuned into that more is doing this podcast. I've gotten to meet other sexologists and different mental health specialists
to.
who, you guys take care of the mental side of things, whereas I take care of more the physiological side. And so
Mhm.
I've been able to pick up tips and tricks from different sexologists we've had on the podcast where I've learned the importance of asking about each individual part of the sexual experience
Yeah.
versus just the physiological part that I can help because I do get to refer to you guys when they need a little bit more of the therapy type.
Yeah, a true person that is a professional, in my opinion, and I'm sure other professionals might argue with what I'm about to say, but somebody that's truly trained in this knows it's a whole picture.
Hmm.
It is sexual, mental, and physical health,
Yeah.
and they're all intertwined. They
Hmm.
all influence your sexual well-being,
Yeah.
and so when they compartmentalize them and put them separately, we're not
Hmm.
putting a human being,
Yeah.
one of us, any justice. I don't know
Yeah.
if that's the right word, but we're not
Yeah.
helping.
Absolutely. I totally agree. We talk about it at work all the time that we really need to have sex therapists and urologists in the same office so they can get
Yeah,
the holistic picture. They can get the Viagra or Cialis or injections if they need it, but they can also get the mental health support that they need
yes,
because they do go so hand in hand in this area of life.
but they
Yeah.
do. But that's another thing we don't talk about
Mhm.
education-wise.
Right.
Even in the when you're learning to be a mental health therapist or you're learning to be a physician,
Yeah.
it might be mentioned in a class, but it's not
Mhm.
depth. There's not a lot of depth into it. Now, granted, I will give physicians a little leeway because they only have so many minutes to talk
Right.
to their patient. They are trying to move them through pretty quickly.
Yeah.
But I agree if it would benefit everybody if a physician's office had a mental health therapist, a sex therapist, and the
Yeah.
physician.
Yeah. Yeah, it definitely makes a big difference, I think, for better patient care. So, if you have a couple that comes in and they're kind of on different pages, whether it's libido or their desires, their kinks, whatever, how do you direct them through a conversation and maybe some exercises or something that helps them get on the same page?
Mostly it's me helping them rephrase, so they have the conversation with me, and then I say to them, "Is this what you heard? How did
Hmm.
you hear it?" So then they have the conversation again until they understand it. That's mainly what I do in the office.
Hmm.
I mean, as far as homework, I'm typical in the sense of referring them to books to read, and I'll refer to the touch therapy,
Hmm.
when they just touch without leading the sex.
Yeah.
Or I'll tell them to take a break from sex. Just most of my stuff is typical and not good. But one thing I do teach every time is communication.
Yeah. Yeah, I mean, communication is huge for any relationship, but
Yeah,
especially for the sexual side of a partnership because, like you've said several times already in this
mhm,
podcast, that these things aren't talked about enough and we
right,
feel shame or we feel they can only be talked about real quietly or, you
right,
don't even know if you should bring it up or you're worried that your partner is going to think you're weird because you want a different position than you've been having or whatever. So,
right.
communication is just huge.
Right, it is, and I mean, it is to me, it's a foundation that
Mhm.
and, ebb and flow of. So,
Mhm.
meaning, like, this is February, so in February, if you say, "I wanna do" hypothetically, if I wanna do the missionary position in the month of February,
Mhm.
and then the month of March, I wanna do a new position, it's having that conversation.
Yeah.
And it's saying to your partner, it has nothing to do with you doing something wrong. It's
Mhm.
just has to do with me wanting something new,
Yeah.
and figuring things out with us.
Mhm.
What pleases you, what pleases me, just
Mhm.
stuff like that.
Yeah.
And granted, what you and I are talking about right now is a small,
Right.
you know, this topic is huge.
It is.
It
It is.
can go so many ways, which is beneficial to the couple,
Mhm.
whatever it is you're doing. But everybody has to be talking.
Yeah. Yep, absolutely. And I like what you said about, you know, taking sex off the table or doing touch without leading to orgasm, because I think, there's so many great ways to be intimate with your partner. It doesn't always have to be penetrative sex or fooling around with the goal of orgasm. It can
But
be the goal of just, how does this feel today? Let me touch you. I just want to hold you.
mhm.
I want to take intimacy to a different level where it's not so goal oriented on climax.
Yeah, it can be. Or it can be only about the orgasm
Mhm.
too.
Yeah.
I just wanna have an orgasm in it. And
Yeah.
that's okay.
Yep.
It's giving permission,
Mhm.
to whatever it is that in that moment.
Yeah. Yeah, absolutely. No, that's fantastic. What other kind of issues are couples coming in? Is it more like prior to the relationship, maybe their cultural background or any traumas they've experienced? Or do you find more patients have issues within a current relationship when they come to you?
All of what you just said.
All of them.
Yeah, I mean, it is. It's a lot of times they'll come in for one thing and then it turns into something else.
Yeah.
So, they might have libido issues,
Mhm.
but then it turns out it's also financial issues.
Yeah.
It's also issues with the kids. It's health issues.
Mhm.
And then they learn everything impacts what happens in the bedroom.
Mhm.
See, many people believe, or maybe they don't as much as I think, but they think that the bedroom is um is separate in some way,
Mm. Mhm.
but it's not. It's
Right.
all a part of the relationship.
Yeah.
I mean, yes, I understand the privacy, kids wise. If you have kids, yes, you want to be private. I understand that.
Mhm.
But just because it happens in the bedroom, you can't leave it there. It's
Right.
going to come out into the rest of the house,
Yeah.
especially if your needs aren't being met, if you're not, like I said, communicating.
Right.
So
Right.
it can stay in the bedroom. Let's say both of you have what you need in that moment. It can stay there because both of you got what you wanted from it,
Mhm.
whether it was just cuddling, with the
Mhm.
orgasm, whatever it may be. Or if one of you wasn't happy or felt like you had to do it,
Mhm.
whatever it is, then that's going to trickle back out outside the bedroom and it won't impact other parts of the relationship.
Yeah.
And as you know, if you're physically unhealthy, that does the same thing.
Yes.
And mentally too.
Mhm. Yeah, absolutely. And it is about the communication, right? I have a partner right now and he came home last night and I had been painting my daughter's room and I tripped taking something out of her room and I rolled my foot under. And I don't know about you, but I do clumsy stuff all the time and man
Yeah,
did it hurt, right? Like it just tore me up. And
right.
so he works late at night and I went to bed well before he came down.
Mhm.
And I had, my pain management, I had my ice, was doing all the things.
Right,
And when he got to my house, I was just like, look, it's not going to happen tonight. I don't know if you're in the mood or not, but I'm just laying the groundwork. You can snuggle, we can touch, we can talk, but I am in pain and I am just not, I tap out tonight. And
right.
he was so good. Like, he's like, absolutely. I'm so sorry you're hurting,
Mm,
but it was like laying that expectation and having that comfort level of just being able to say, like, this in this moment today is not you. It is me and I'm in pain and there is a reason that I don't want to cross that bridge right now.
right,
And so I think that's really important when you can have that level of openness and communication with each other. And I know that there are couples that struggle with even that basic conversation
right.
because they've fought about this so many times over the years. Well, you're never in the mood, or, and so when there is a legitimate reason, it's like, oh, it's just another excuse, or so I can imagine that you deal with a lot of trying to get people to work through things that they've, like, this built up resentment or something.
Yeah, you do. I do. But and I have to say, a lot of the times where people come to specialist sex therapy, they come way too late. So
Ah,
what I mean is, they've been dealing with it for over a year. And
yeah,
I'm being nice with
yeah,
over a year.
right.
And
Probably a lot longer.
right. And then they come to the session and they think it will be solved in 1 to 2 sessions. You're only focusing on why they entered therapy,
Right,
but like I said, a therapist, if they're doing their job, you could realize there's more to it than the fact that you two aren't having sex.
right.
You're right, resentment builds up.
Hmm.
And then, so you do have to learn how to break down the barriers.
Yeah.
And you have to get to the core of the matter. You have to get back what they say, peel an onion.
Hmm.
There's so many layers to it. So,
Right.
and that's another thing. People are taught there's always a quick solution,
Hmm.
especially with technology. We can do things so much quicker
Right.
in that regard. So we think it transfers our relationship. No, it doesn't. It's
Yeah.
still a process. Therapy is a process. I find people give up too quickly in therapy
Yeah.
because they don't get the result as quickly as they want.
Yeah.
They end it. And they don't end it saying communicating that. They're not,
Yeah.
give the therapist a chance to say, I mean, I tell them from the get-go, don't expect quick results because
Mm.
if I could do it in 1 session, my fee would be a lot higher than I'm
Oof.
charging,
Yeah. Yeah.
So, yeah, so I do explain all this.
Yeah.
However, people do get frustrated,
Yeah.
it's not going how I thought it would go. And that's
Hmm.
the other part. Are they communicating that to the person they're paying money to? Because
Right.
they're not talking to me. You know what I mean?
Yep.
So it's
Well, and going through therapy is tough. I
yeah,
mean,
it is.
you're peeling back those layers. You're bringing out things that have been hurtful in the past. I mean,
Right.
I love therapy. I am a huge proponent of it in every aspect of life. It has helped me immensely become a better version of myself. And so, yeah, I can just, but there are moments where it's like, man, I really don't want to go today because I know today is
Right.
going to be tough and it's going to bring stuff up. But you have to work through the hard to get to the good.
Mhm.
And I think that a lot of people want the quick fix. Why isn't there a pill to fix this? Like,
Right.
where's our Ozempic shot for PTSD, or you
Right.
know?
Right.
And so I think, yeah, it does take a lot of work and commitment to therapy, but it's so beneficial if you go.
Right. It is. Of course, I'm gonna say yes, it is.
Yeah.
Yeah.
Yeah,
So,
exactly. And
mm,
it's interesting that you do couples. So for your sexology patients, do you have couples that come together? Do you do
mhm.
individual sessions? How do you work that?
But I did both. Sometimes I'll see them individually, and
Hmm.
then I'll bring in, the other part of the
Hmm.
relationship. It depends.
Yeah.
Sometimes it's an individual issue, and then the other half needs to come in to learn.
Hmm. Yeah. How do you work with patients who have experienced a past trauma, whether it was, a rape, a random rape, a family member sexual assault, or a babysitter, or something like that, who now harbors this negative energy towards sexual activity? How do you help them work through that?
If they truly have PTSD or, depression or some other DSM-5,
Hmm.
true label that they meet, they don't see me. They need
Okay.
to see somebody else to work with that.
Okay.
Now, can I work with some of it? Yeah, I mean, I am licensed. However, sometimes, based on what you're saying,
Hmm.
that's a deep issue.
Yeah.
It's a whole different therapy. That
Hmm.
has to be addressed before the sex
Yeah.
can be worked on, the
It's a great point.
sexual.
So work through the trauma first, and then you can hopefully have a healthy sex life
Right.
after you've
Then
pulled the layers.
the therapist should be referring back to me. So
Right.
whoever's helping them through the trauma, that's one thing. Then they
Yeah.
refer back to me,
Yeah.
and then I'm helping them implement a healthier sex.
Yeah. So is a lot of sexology more like the cognitive behavioral type of things that you're helping them do, or what
Yeah,
kind of yeah, okay.
yeah,
That's
I
kind of
mean,
what I'm like hearing when you're saying like
right.
you're talking through things, you're giving them some things to try when they go home with or without their partner.
Right, there's all kinds of, like, somatic therapists, stuff like that,
Yeah.
and that's good too, but in my opinion, they have to be self-aware to do that therapy.
Yeah.
Because if you're doing somatic, which is awesome, and you have previous trauma, that's gonna come flooding out in that
Sure.
session.
Yeah.
So and hopefully then they refer out.
Yeah. That's amazing. Yeah.
Mm,
I love that you have that work for people that need it because I certainly see it a lot in my office that I'm referring out when there isn't a physiological issue or we've tried medication for the part that is physiological, but
right.
there's still just something missing. So I genuinely appreciate what you do. Let's switch gears and talk about Kiss and Tell magazine. Tell me how that got started and what your goals are with that.
So, well, many things, but one of the reasons it got started is because, oddly enough, I was in checking out at the supermarket, and you know how you see the magazines in that
Hmm.
checkout line. Well, I happened to be looking at them, and you look at, whatever the headline is that they're trying to draw your attention to.
Hmm.
So I'm looking, and I realized at the time a lot of them have at least one sex article that they're trying to draw your attention to.
Yeah.
And then I thought about it, I'm like, wait a minute, most people get their information from a magazine
Hmm.
as far as this topic is
Yeah.
concerned. And most of that stuff is incorrect.
Hmm.
It's continuing the problem that people have with this topic.
Yeah.
So I immediately went back to my mentor and, that day and made a comment about it. And of course, he supported it and liked the idea. And then I had two kids and got sidetracked.
Yeah. That
So,
happens.
yeah.
That happened with me when I had kids too.
Yeah. So once my kids were self sufficient, then I showed the online magazine.
Okay.
But
That's really cool.
yeah, the purpose of it, kiss and tell is supposed, it's just supposed to be cute,
Yeah.
but it is about talking about sexual health and giving people the freedom to do it with accurate information.
Yeah.
It's also to support the field. Uh,
Okay.
we'll be launching once it gets through the beta test, but we'll be launching a search so
Okay.
professionals can list themselves. And as long as they're set positive,
Yep.
they'll be listed. And then we're giving them two options, one to pay a monthly fee to be free, but they have to contribute 4 articles a year.
Okay.
But the purpose of that, other than to have income for K&T, is to showcase all the professionals in the field. This is a site that supports what they do for a living. Because, in my opinion, based on what you see media-wise,
Yeah.
they always go to the same couple people who, I won't name names,
Yep.
and those people aren't necessarily trained in this topic.
Yeah.
So they're not really helping the topic move forward.
Yeah.
Um, so, that's what, K&T trying to do.
Yeah, I think that's amazing. So, a lot of your or all of your information is scientific based, medical and
Yeah,
psychological, those kinds of things, like from, okay, so
right.
it's not random people writing in or giving their opinions or anything like that. You have professionals that are giving scientifically backed data.
Right, they are, and there's always, depending on what the story is, but there's always something that supports what they're writing.
Okay.
it's not, we try to keep it as a magazine feel as we can. We don't want to make it sound like a journal.
Sure.
But yeah, we're not just throwing stuff at the wall. It has
Yeah.
to it's
Yeah.
supported. So
Yeah.
supported by the right source. So it is
Yeah.
chat.
Yeah. No, I love that because there's a lot of times where, you know, a sex therapist that we had been using pretty heavily for our practice, stopped practicing. Unfortunately, she was in kind of a tragic accident and ended up having a stroke and stuff. So she wasn't able to practice. And I was looking for some new people to recommend. So this sounds like a really great place to be able to pull from. Do you have both on the mental health side and the medical side? Okay.
Right.
So you have urologists,
Yeah.
gynecologists, things like
They're
that.
on they're on the list. And
Okay.
what's happening now is people are testing it and that there's always glitches or they don't there's just a lot of randomness happening
Mm-hmm.
right now. But once it launches, it is marketed to doulas, urologists,
Okay.
gynecologists, sex therapists, coaches, all
One
that.
stop shop.
But it's not just sexologists.
Yeah.
There's so many different professionals in the field,
Yes.
but it's not we're not marketing to influencers. So
Yeah. Okay. Got it.
yeah,
Got it.
they
Yeah.
have they
We
have
don't need influencers trying to provide medical information.
right, they have to be
Very cool.
not just because legitimacy for the site, but
Yeah.
also legitimacy for the field.
Absolutely.
I want this field to me, they've been squandered and squashed, and I'm like,
Right.
why? They're not
Right.
doing anybody in this field, be it a marriage family therapist, be it a sex therapist, whatnot. No one's doing it just because they want to make money necessarily.
Right.
It is because they believe in educating people. They want people comfortable in the bedroom.
Right. No, I completely agree. I think, I get asked the question all the time, mostly by my men when I'm doing their prostate exam, like, how did you get into this field? But
Mhm,
plenty of my patients, both male and female, will be like, why do you want to do this? And, there are aspects of urology that don't really thrill me. I don't get excited by kidney stones. I don't really get excited by prostate issues, but
mhm,
I love the sexual side of urology. And it's so amazing that you can save relationships. You
mhm,
can help someone get out of depression. You can help with all these things just by helping them regain that intimacy and that their sexual being, whether it's by themselves or with a partner.
yeah. Very good. And
Yeah.
that's why I want, KNT to be, is a source that people can go to, they learn something from.
Yeah.
Are we still growing? Are we still getting the kinks out? Yeah, I mean,
Right.
we're evolving,
Yeah.
but like I said, it's a spot for people to know it's okay to talk about this topic. It's
That's
not
awesome.
something to be shameful. I mean, when I
Yeah.
say the word sex, out in public and people look at me,
Mhm.
okay, so you're looking at me, so what? I
Right.
mean,
Right.
I'm not bursting into flames,
Yeah.
so it's just, I mean, yeah, I understand. I just don't think it's something we should be whispering about anymore.
I completely agree. I
In the
completely
fif
agree.
in the 50s, when women and men were still wearing dresses and all that stuff, fine,
Yeah.
but we're not there anymore.
Right.
I understand some people are trying to make us go back there, but, we're not. No, it's
Right.
2025. Let's admit the fact that we're progressing. Why should we progress technology-wise, but not when we talk about certain subjects? It's
Yeah.
silly.
Yeah, absolutely. I completely agree. Now, so we can look up other professionals on this site. What about patients who want to find someone? Will it have that as well, where they
Yeah,
can kind of use it as a directory also?
yes, it will be nice.
Awesome. I love that. Okay, so Kiss and Tell magazine. Awesome. So we'll put links in the show notes and, of course, information about Dr. Jenny and how you can be in touch with her. Thank you so much for being on here. What a great conversation today.
Yeah, thank you as well.
Absolutely. Everybody else, we will see you next time on Between the Sheets. Have a great day.
Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.